Hello and welcome. Today we're diving deep into a fascinating and sometimes alarming condition affecting our vision, optic neuritis. We'll explore what it is, what causes it, how it's diagnosed and treated, and what the future holds for those affected. So, let's get started on this enlightening journey. So, what triggers this inflammation? While the exact cause of optic neuritis often remains a mystery, several factors are known to play a role. In many cases, it's linked to autoimmune diseases like multiple sclerosis, or MS. In MS, the immune system mistakenly attacks the myelin sheath, a protective covering around nerve fibers in the brain and spinal cord, including the optic nerve. Other autoimmune conditions such as neuromyelitis optica, also called Decoder's disease, and systemic lupus erythematosus, or lupus, can also be associated with optic neuritis. Infections, such as Lyme disease, syphilis, measles, mumps, and chickenpox, though rare, can also trigger it. In some instances, certain medications and toxins can be implicated. However, in a significant number of cases, the cause remains unknown, which we refer to as idiopathic optic neuritis. Now, let's delve into the intricate mechanisms behind optic neuritis. The primary problem is inflammation of the optic nerve. This inflammation disrupts the normal transmission of electrical signals from the eye to the brain. Remember, the optic nerve is essentially a cable carrying visual information. When inflammation occurs, it damages the myelin sheath. This damage to the myelin, called demyelination, slows down or blocks the signals. It's like having a kink in a garden hose the water flow, or in this case, the visual information is significantly reduced or stopped altogether. This disruption results in the visual disturbances that are characteristic of optic neuritis. Depending on the severity and location of the inflammation, the impact on vision can vary significantly. Understanding who is most likely to develop optic neuritis is important. It predominantly affects adults, typically between the ages of 20 and 40, although it can occur in children and older adults as well. Women are affected more frequently than men. While it can occur in any population, studies suggest that it is more common in people of Caucasian descent. The prevalence of optic neuritis varies geographically, with higher rates observed in regions where multiple sclerosis is more common, suggesting a strong link between the two conditions. How does optic neuritis manifest itself? The symptoms of optic neuritis can vary but often develop rapidly, usually over a few days. The most common symptom is a decrease in vision in one eye. This vision loss can range from mild blurring to complete blindness. Pain is also a hallmark symptom, often worsened by eye movement. Many individuals experience a reduced ability to distinguish colors, a condition known as dyschromatopsia, with red being particularly affected. Brightness may appear diminished in the affected eye. Flashing lights, or phosphins, may also be reported, especially with eye movement. These symptoms can be quite alarming, and it's essential to seek medical attention promptly if you experience any of them. Diagnosing optic neuritis involves a thorough eye exam and neurological assessment. First, an eye doctor will evaluate your visual acuity, color vision, and visual fields. A dilated eye exam allows the doctor to view the optic nerve directly to look for signs of inflammation or swelling, known as papilla. Neuroimaging studies, such as MRI scans of the brain and orbits, are crucial to identify lesions suggestive of MS and rule out other causes of optic nerve damage. Visual evoked potentials, or VPs, measure the electrical activity in the brain in response to visual stimuli and can help detect optic nerve dysfunction. Blood tests may also be performed to rule out infections or autoimmune diseases. These comprehensive tests help confirm the diagnosis of optic neuritis and identify any underlying conditions. Optic neuritis can be classified based on its cause and presentation. As mentioned earlier, we have idiopathic optic neuritis, where the cause is unknown. Then there is optic neuritis associated with MS, which is the most common type. Another important distinction is between typical and atypical optic neuritis. Typical optic neuritis usually presents with pain, vision loss, and optic disc swelling and is more often associated with MS. Atypical optic neuritis can have different features, such as severe optic disc swelling or involvement of both eyes simultaneously, and may suggest other underlying conditions like neuromyelitis optica or MOG antibody disease. So, how do we manage optic neuritis? The primary goal of treatment is to reduce inflammation and accelerate recovery. Intravenous corticosteroids are often the first-line treatment, administered over several days. This can help speed up the recovery of vision, though the long-term visual outcome may not be significantly altered. Oral steroids may be prescribed after the intravenous course, but are generally avoided as a sole treatment due to the risk of recurrent attacks. In cases associated with MS or other autoimmune diseases, disease-modifying therapies are used to prevent future relapses and reduce the risk of disability. Supportive care, such as low vision aids, can help individuals cope with residual visual impairments. Regular follow-up appointments with an ophthalmologist and neurologist are essential to monitor progress and manage any complications. While there's no foolproof way to prevent optic neuritis, several strategies can reduce the risk, particularly in those with underlying autoimmune conditions. Managing autoimmune diseases, such as MS, effectively with disease-modifying therapies can lower the risk of optic neuritis relapses. Avoiding known triggers, such as certain medications or toxins, may also be beneficial. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding smoking, can support overall immune health. Prompt treatment of infections can prevent them from triggering optic neuritis. By taking these proactive steps, individuals can minimize their risk and promote better visual health. What does the future hold for individuals with optic neuritis? The prognosis varies depending on the underlying cause and the severity of the initial attack. Many individuals experience significant recovery of vision within a few months, though some may have residual deficits, such as reduced color vision or contrast sensitivity. The risk of developing MS after an episode of optic neuritis is substantial, particularly in those with brain lesions detected on MRI. Regular monitoring and follow-up are crucial to detect and manage any potential complications or relapses. Recent research is focused on identifying biomarkers that can predict the risk of MS conversion and developing more effective treatments to prevent optic nerve damage and improve visual outcomes. Newer therapies, such as anti-MOG antibodies, are showing promise in treating atypical forms of optic neuritis. Ongoing research continues to provide hope for better diagnosis, treatment, and management of this condition, ultimately improving the quality of life for those affected.